Hello my friends, welcome or welcome back to my channel. It's Mama Ming here. In today's video, I want to talk about labor and delivery. At the time of filming this video, I'm 31 weeks pregnant and 1 day, and my baby girl, my second baby, is coming in 2 months. I'm super excited, but also super nervous. I keep replaying my labor and delivery, what went really well, what I learned from my experience from my first labor and delivery. I had a really good experience, and I was trying to calm my mind and creating a birth plan with myself, and later with my OB. I know 31 weeks is still early, but time flies by, and sometimes when I sleep, it definitely makes me nervous knowing that a baby girl is coming soon. So if that is you, if you're in your third or even second trimester thinking about what labor and delivery is like, if you've never had that experience, I hope this video can be helpful to you as well. Before we start, I just really need a favor from you to subscribe to this channel, maybe help me to get to 1,000 subscribers by the end of this year, and I really appreciate your support. All right, so now let's talk about labor and delivery. Labor and delivery is one of the biggest life events I feel like I had in my life. It's a life-changing event, and honestly, anything could go right, anything could go wrong. There were times when very low risk pregnancy suddenly went wrong and had to have an emergency C-section or have some issues with the baby during birth. But there are also times when I had a very high risk pregnancy last time, but my labor and delivery was very smooth. These are the things to consider, and these are the ways that you can advocate for yourself during this experience. The first thing is to create a birth plan. And honestly, the birth plan is it's not something that you really obey to. It's not like a daily planner. It's not like something that will actually happen as it is, but creating a birth plan literally will outline your major preferences. It will give yourself an idea what it looks like. It should be like a really simple birth plan. It's like about 1 pager, but honestly, I did not have like a written down birth plan just because I discussed with my OBGYN before. We had a discussion. So these are the things you want to consider if you are closer to your labor right now. If you're thinking about what are my plans are, the first thing to consider is if you're open to induction. So some people, they prefer to wait it out a little bit more. Some people, they want to be induced at 39 weeks, 40 weeks, 41 weeks. So personally, I want to be induced at 40 weeks. I do not want to wait for past 40 weeks. It's personal preference. So I, express that with my OBGYN, with my provider. The second thing is to think about who you are going to include in the birth and delivery room. So usually you can take about 2 people depending on the hospital. So of course I want my husband to be there, but you can hire a doula. You could also ask your mom to be there or ask a friend. It's your choice, but these are things that you want to consider. Who do you want to become your support person? Like if you don't have a partner, which friend do you want to take? Which family member do you want to take? Because these are going to be the most vulnerable time in your life. So one of my best friend actually invited her mom in, and then she felt bad if she doesn't include her mother-in-law. So she had her husband, her mom, and her mother-in-law. This was more than 20 years ago. And she said that's her worst decision ever because during the birth, the mom and mother-in-law had an argument, and she was like, just get out of the room, and the pain and everything. So choose the people that you feel like you can be vulnerable about and count on, and not giving you anxiety and stuff like that. So choose who do you want to be the support person during birth. The third thing that you want to consider is where do you want to give birth? Of course, I chose my OB because I knew she delivers in certain hospital with level 4 NICU. But if you choose other environment, you may have to change your provider because certain provider, they change us different hospitals or different birth centers or even home birth. So these are the things you consider. But also the things that you consider is about pain relief, pain management, and the birthing positions. So I would say that I had a birthing position that I thought of that I want to use, but at the time of giving birth, I chose a different position. Like I said, when you're giving birth, things could move on really fast. It could go really well or going not really well. You can't really control a lot of factors. There's so many things that are so unexpected. So if you want certain birthing positions, communicate with your nurse. And then I think when I was about to push, my nurse was like, do you want to go to the tabletop position that like you told me about? I really appreciated that because I communicated her that I wanted to push the baby from a tabletop position because I heard it reduce the amount of tear or the chance of tear. And she, before we started pushing, she asked me if I wanted her to put me into that position. She will help me, and I really appreciate it. But I was like, no, I want to push from the sideline, which resulted a little bit issues, but I was okay with it. It was really fast. But the next thing is pain relief. In my first pregnancy, I always have ITP, which is a bleeding disorder. So I did not qualify for epidural because my platelets was very low. But on the day of my delivery, the platelets was like high enough to qualify for epidural, because if you do have a bleeding disorder, they don't want to give you a spinal injection just in case you have a spinal bleeding. It could become very dangerous if you have a spinal hemorrhaging. So my doctor communicated with me that they may not be able to give me epidural. I may not be able to use that. I could use fentanyl or other pain relief methods. And I told my doctor I do not want to decide on that until the day of. And on the day of, I magically qualified for epidural. So I told them that I'm willing to take epidural at the time, but I want to see how it progresses. So these are the things that you want to consider when you're making the birth plan. Once you establish the preferences, communicate the preference with your partner or your supporting person, communicate with people that you may need to take you to the hospital, communicate with your OBGYN, and by the time you talk to your nurse, your delivery nurse, tell them, hey, these are my plan, but it could change. Please check with me when it's time to make the decision. So it's important to tell them to check with you when it's time to make the decision, because your decision could change. Because you may have a lot of pain, you may not decide, you may not want an epidural at the beginning, but then you want it. These are the things that you want to think about before. And the second thing is to make sure that during birth, talk to your nurse and talk to the OB, talk to the doctor who's delivering, because it may not be your OB, be the on-call doctor. So every time there is a decision, use this BRAIN method. B stands for benefits, R stands for risk, A stands for alternatives, I stands for intuition, and N stands for nothing. So every time to ask your question, talk to them, what are the benefits of doing that? What are the risks? What are the alternative? How do you feel at the moment? And what does your gut tell you? And also, what if we do nothing? So one of the decisions actually is my OB actually. My OB asked me if they could break my water. I told them no. And then I was telling my friend about my birth story, and my friend was like, isn't that a professional opinion from your doctor? Like, why would you reject your doctor? Doesn't your doctor know more than you? I was like, not necessarily. I actually looked into the research. To break your water during birth is to help you to progress. But sometimes I looked into the research, or there's a correlation between your water break and your birth progression. However, they don't know if it's a cause of effect. And once they break your water, there is a specific timeline that have to get the baby out, because they can't have the baby in there for 2 days after your water broke. So they may actually end up giving you a C-section. So when my doctor asked me, can I break your water? I asked them, what's the benefit of breaking water? And she said, this is to help you to progress, to dilate more. And I asked her, like, what are the risks? They're like, yeah. I was like, if I break the water, how many hours am I looking at? They're like, yeah, once they break the hours, we usually want to get the baby out within like 20 hours, 24 hours. And I said, I want my body to naturally break my water. So I want to wait it out. And she's like, okay, I'll check with you in several hours. If you don't progress, I will ask you again. I said, yeah, that sounds like a good plan. So my intuition tells me that my body will naturally break the water to progress. And honestly, I think about 4 hours, the baby actually came out 4 hours after she initially asked the question. So about 3 hours after she asked the question about breaking my water naturally broke 3 hours after she asked. So the reason why I denied it was because I didn't want to be put in a timeline, and I felt like the risk is not worth the benefits. And I felt like my gut, my intuition is telling me that my body will do it itself really soon. The doctor doesn't feel how I feel. I was feeling stronger and stronger contractions. And also I wanted to give my body time. Maybe if my water didn't break in 3 hours, I may choose to break it like manually, but I just decided to wait it out to see. So it's very important to ask these questions and make decisions as it goes on, because a lot of things could happen. Like I wasn't progressing from 3 centimeters to 4 centimeters. I think I was at 3 centimeters around like 7:30, and then I was at 4 centimeters around 10. So it was like about 2.5 hours. I only progressed 1 centimeter. They're like, maybe we could try breaking a water. I said no, but guess what? I was 4 centimeters at 10:30. And 1 hour later, I was at 10 centimeters, time to push. It took me 1 hour from 4 to 10. That's crazy, right? The thing is, you never know. Like the doctor said, this never happens in someone's first pregnancy, but hey, anything could happen. And the doctors, they don't know, because doctors, they only know about other patients, the statistics and their experience. They never know you. Like you're the person who's experiencing the contractions. You're the person who knows. So listen to your intuition. Don't just say whatever they want to do it. Like think about it, ask questions, and make decisions together with your care team after hearing it out, the risk and benefits, and thinking about how you feel at the moment. So the next one is to speak up about your discomfort or comfort, and also consent. It's okay to say no to a doctor. It's okay to say no, that I need more time, just like I did. Ask to be informed before any exam or intervention. Like ask them like, what is this exam? What are you doing? What's the benefit of this exam? And what do we get? What's the result of the exam? Before any intervention, ask questions before they do anything. They cannot do anything to you without your consent. If you feel like during birth is too stressful, talk to your supporting person. Make sure they ask the questions for you. Make sure that you're informed before any actions are taken. The next one is to know your rights. You have the right to be informed, to be educated, and you have the right to refuse them. And when you refuse them, don't be disrespectful. I mean, if you're disrespectful, they're gonna, like, just think about it. Nurses and doctors, they're human too. Like, if I just tell them, like, stop touching me, don't do this, that's like very disrespectful. They're here trying to help you. They're taking care of multiple patients probably at the same time. So instead of like, just, I know you're probably in contractions or you're hurting everything, but try to have a conversations like, can you inform me the benefits? Can you inform me the risk? What if something happens? What are the chances of this happen? And after questions, you say like, can I wait? Can I wait for another hour or two? Can you check with me in an hour and two? Like just ask them questions like a normal conversation, be nice about it, and know your rights that you can say no. Sometimes you know your body better than the other persons, even though they're like medically trained. Lastly is to stay calm but very firm. It's very important to be calm, respectful to the medical professionals. You have no idea how grateful I am to my delivery nurse, because she is the reason why I had a really good experience. Because during my birth experience, I wasn't progressing because my baby was in a bad position to be delivered. My baby was sunny side up. So sunny side up means the baby's head, the baby's face is facing forward, not backwards. And that could increase the risk of a lot of things. That could also make you have back-to-back contractions, which in my case is. So my nurse was checking on me every 15 minutes. She noticed on my contraction graph that I was having back-to-back contractions. She called the doctors. They checked the position of the baby. They checked everything else. And they were like, we need you to turn into a position where we are waiting for the baby's head to turn. So after the baby's face turned down, everything just moved down really fast. But I also have friends and family members who actually end up in an emergency C-section because the baby was sunny side up and the baby's oxygen levels and other things are going low and it wasn't progressing and that they already broke the water and everything. So the reason why I had such a good, like, smooth experience is literally because of my one delivery nurse that noticed that my baby was in sunny side up position that's not ready to be pushed. And she was able to turn me into a yoga position where the baby's head can turn. She's very experienced. She's had 4 babies babies of her own. She's delivered, actually, she's had 5 babies now. She's delivered babies with and without epidural. She's experienced all of them. And then she was like, this is happening. And I was so grateful. So when you communicate with your care team, make sure you're respectful, make sure you treat them nicely, and they will treat you nicely. They really, really care. If you care about them, they will care about you. But try to stay calm but be firm. Like, do not just say okay, or just say, I prefer this, I do not want to do this, can you explain more, please? And then like try to make a joint decision with your care team instead of like just saying yes to whatever the doctor or nurses said. Because sometimes like what works for other women routinely doesn't always work out for you. Every single case is very different. To stay calm and communicate with your support team and your supporting person. I would say that in my first delivery, my husband was freaking out. He was more freaking out than I did because I was very clear. I was not like, whatever. But there is a moment that happens to a lot of women, but not everyone. Right before you deliver the baby, the hormones leave your body really, really fast, and adrenaline kicks in that your body is uncontrollably shaking. Like you're literally shaking, like you're having a seizure. And the nurses have seen it, the doctors have seen it, I have seen it from other labor and delivery vlog. My husband never saw it. So when my husband saw it, like he was freaking out. He thought I was gonna die. He thought I was having a seizure. But my doctor was like, oh, good. You're having the baby shake. This is the baby shake. The baby is coming. You need to get ready to push. And then like everything just happened so fast. And because my body progressed, my labor progressed so fast, my hormones are leaving my body super fast, and my adrenaline kicks in. It's getting my body ready. I felt adrenaline kicking in. I was getting ready. I had a burst of energy to push, and my husband was freaking out. And I was like, just shut up, go away, just leave. It's okay to tell the freaked out support person to leave as well. So just FYI, be careful. Like sometimes the support person pass out, freak out before the delivery, before the mom. So my husband told me that he was freaking out. He thought I was gonna die when I was shaking uncontrollably. I was like, this is because you don't educate yourself. So another thing you could do is to, educate your partner. But I would say that taking birthing classes, like I've actually taken 2 birthing classes from different doulas. I did not like either of them. I feel like it wasn't informative as like the internet and the books. I really like one book. I'll pop the book cover right here, link it down below, from Amazon. Personally, I took my husband to take 2 birthing classes. One of the birthing classes is like 2 stage, like all day. The other one is like half of a day. I honestly did not think the birthing classes that we took was beneficial or helpful at all. Everything you talk about, I already read it from the internet or from the books. And this is the book that I recommend. This is the Pregnancy, Childbirth, and the Newborn, a Complete Guide. I got it from Half Price Books at $7.99, but you can get it from Amazon. It's really, really, really good. This one has a lot of good information. If you see it, I actually highlighted a lot of the information from the book. There are different techniques, birthing positions, and things about pregnancy, diet. Like this is very comprehensive. I highlighted a lot of things. This is a really good beneficial. Link down below from Amazon. But the birthing classes that we took are super expensive. They're like $150 per person, but they were not beneficial at all. So if you have free birthing classes from a hospital, definitely go. But I feel like with these books, and there are a lot of videos online, I honestly don't think it's that necessary. I know this is an unpopular opinion. If you think it's necessary, definitely go. But I took my husband to 2 birthing classes separately. It took 2 weekends. He didn't learn anything. Well, I didn't learn anything because I already read everything in the book and the internet. But he learned some things. He learned about the centimeters, the different stages of labor, whatever. But none of the birthing classes talk about the uncontrollably like shake before birth. But I saw it on YouTube. I saw it in the book. I saw, like they said, it happens to a lot of the women, but not everyone. And that's like a normal response to the drastic hormone change, to hormone leaving, hormone coming, to prepare you for the specific labor. And it just freaked him out. If you do decide to take a birthing class, maybe it's beneficial. Maybe it's just the doulas that I took it with wasn't really helpful. It's not to say all birthing classes is bad, but try to read this book. And there's so much great information online from different OBGYNs and midwives. And there are also a lot of videos that give you actually the birthing experience vlog. Like you actually see the uncontrollable shake from a specific mom sharing their birth vlog, which was definitely very helpful, like watching those birth vlogs. Like it prepares me to know when I'm shaking like this, it's normal, it's okay. And it's specifically, my doctor was there saying, hey, you got a baby shake, the baby's coming, congratulations, hang in there. Versus my husband's like freaking out. So he freaked out way more than I did. So yeah, that's it for today's video. Thank you so much for watching. If you found this video helpful, share it with your friends. Make sure you thumbs up and subscribe, ring the notification bell, and I hope to see you in the next one. Bye!